In this PowerPoint, we are going to be covering antenatal screening and the learning intentions on page 17, where we're asking you to describe the process of antenatal screening and its purpose. Describe the role of an ultrasound, including a dating scan and an anomaly scan. State the purpose of blood and urine tests carried out during pregnancy. Explain the role of diagnostic testing, including a comparison of amniocentesis and CVS. And finally, state what is meant by the term karyotype. The health of a pregnant woman and her developing fetus can be monitored using a variety of techniques and tests. Several methods of antenatal screening can be employed to identify the risk of the fetus inheriting a genetic disorder or chromosomal abnormality. Further tests can then be carried out if necessary. With her consent, the mother's blood pressure is monitored, her blood type identified, and general checks such as blood and urine tests carried out as shown on the diagram in front of you. The female is also offered routine ultrasound imaging scans throughout her pregnancy. When an ultrasound scanner is held against a pregnant woman's abdomen, it picks up high-frequency sounds that have bounced off the fetus, as been shown in the image in front of you. These are converted to an ultrasound image on a computer screen. A pregnant woman is given 2 ultrasound scans, the first one being a dating scan, the second one being what's called an anomaly scan. A dating scan is carried out 8 to 14 weeks. The ultrasound imaging is used to produce a scan that would help to determine the stage of the pregnancy. It's also used to calculate the date of when the baby is due to be born. Dating scans are used in conjunction with some biochemical tests, which we'll talk about in a second, which show for marker chemicals. The female is also allowed to go for a further ultrasound imaging performed at 18 to 20 weeks to produce what's called an anomaly scan. This allows a check to be made for the presence of any serious physical abnormalities in the fetus. So pregnant women are given 2 ultrasound scans. A dating scan takes place between 8 and 14 weeks to determine pregnancy stage and due date. An anomaly scan is given between 18 and 20 weeks to detect serious physical abnormalities in the fetus. A woman's body undergoes many physiological changes during pregnancy. This is the normal course of events. Many of these changes, such as the concentration of hormones such as the human chorionic gonadotrophin hormone, can be monitored by what we call biochemical tests. It's actually the detection of the HCG hormone in blood and urine following implantation that's the basis of what the early pregnancy tests surround. At 16 to 18 weeks, the pregnant woman is offered a series of biochemical tests that check for 3 markers. The results of these tests, involving taking urine samples and blood tests, can be used in conjunction with the mother's age and allows medical experts to assess the likelihood of chromosomal abnormalities being present in the fetus. Normally, other routine tests are also carried out to check the health of the pregnant woman and the developing fetus, by monitoring renal behaviour, liver and thyroid functions, and other biochemical changes. Some of these tests can be used to detect situations such as pre-eclampsia early on in the pregnancy. Some medical conditions are indicated by the presence of certain marker chemicals in blood and urine. However, these marker chemicals vary during pregnancy. At one stage, the presence of a high or low concentration of a certain marker may indicate the presence of a genetic disorder in the fetus, whereas at a later stage in the pregnancy, a high or low level of the same marker may be of no significance at all. So, for example, in a normal pregnancy, the level of human chorionic gonadotrophin increases during weeks 6 to 10 and then decreases to a steady low level later in her pregnancy. However, it remains at a high level throughout the full pregnancy if the fetus has Down syndrome. Risk assessment based on the result at 10 weeks would be meaningless in this case, since both a normal pregnancy and a Down syndrome pregnancy would show an elevated result. If a marker chemical was measured at an inappropriate point in the timescale and found to be high, significance could be attributed to it mistakenly. This would lead to what we call a false positive result, where the test would show the fetus to have the condition when in fact it does not have it. Similarly, if the test for the marker was carried out and found to be low at a time when the normal value is also low, this could give what we call a false negative result. This would suggest that the fetus does not have the condition when in fact it might actually have it. It is able to assess the probability of a Down syndrome fetus using some screening tests. The most common one is a blood test for alpha-fetoprotein, which is shown on your screen. During pregnancy, alpha-fetoprotein, otherwise known as AFP, is produced by the fetus and its concentration in the mother's blood increases. The level in the mother's blood decreases sharply soon after the baby is born. Low levels of AFP, lower than 0.4, are found in cases of Down syndrome fetuses. However, this test marker is part of the biochemical screening test that we've just discussed, but is not a diagnostic one. Therefore, even if a result shows a low level of AFP to be present and indicates a high likelihood, it doesn't mean that a chromosomal abnormality has been diagnosed, and it would require further tests to be able to accurately predict whether the fetus did have Down syndrome or not. A screening test is one that is used to detect signs and symptoms associated with a certain condition or disorder. If the signs are found, the probability that the individual has the condition can be assessed by what we call a degree of risk. A diagnostic test, on the other hand, which we're about to discuss two methods of, is a definitive test that produces results that can be used to establish without any doubt whether or not the person has a specific condition or disorder. Certain diagnostic tests may be offered to a pregnant woman if evidence of a potential problem has already emerged from the results of an earlier routine screening test, so for example, the biochemical tests or a scan, whether there is a history of a harmful genetic disorder in her family, whether she is already known to belong to a high-risk category, So, for example, women over the age of 35 have an increased risk of carrying a Down syndrome fetus. Amniocentesis is one of these diagnostic testing procedures. An amniocentesis is carried out at about 14 to 16 weeks. It involves the withdrawal of a little amniotic fluid containing fetal cells. These are cultured, stained, and examined under the microscope. A full chromosome complement is photographed and the chromosomes arranged into pairs to form the karyotype. This technique, which takes about 2 weeks, allows chromosomal abnormalities to be detected. A chromosome containing an extra copy of chromosome 21, for example, would indicate Down syndrome. The parents may then elect to have a pregnancy terminated. Another example of a diagnostic testing is a technique called chorionic villus sampling, abbreviated to CVS. CVS involves taking a tiny sample of placental cells using a fine tube inserted into the mother's reproductive tract. The cells are then cultured and used for karyotyping, as we've mentioned with amniocentesis. One benefit of CVS is that it can be carried out as early as 8 weeks into the pregnancy. The prospect of a termination at this stage is much less traumatic for many would-be parents than at the 16 weeks or later following an amniocentesis. However, CVS causes a higher incidence of miscarriages than amniocentesis. For your own personal notes, CVS can be carried out earlier in pregnancy than amniocentesis, but it does carry a higher risk of miscarriage. From an amniocentesis and CVS, a person's karyotype can be identified. A person's karyotype is a visual display of their complete chromosome complement, with the chromosomes arranged as pairs showing their size, form, and number. For your own personal notes, cells from samples can be cultured to obtain sufficient cells to produce a karyotype to diagnose a range of conditions. A karyotype shows an individual's chromosomes arranged as homologous pairs. On the screen in front of you, we have what we would class as a normal karyotype. 46 chromosomes arranged as pairs. Chromosomes 1 to 22 are the same for males and females, regarded as being called autosomes. The 23rd pair differs, with females having what we call homologous pairs, they match each other, and males having non-homologous pairs, an X and a Y. Here we have the karyotype for an individual who would have Down syndrome. Chromosome 22 has an extra copy. Down syndrome is often referred to as being trisomy, an example of a trisomy condition, because there is an extra chromosome. This individual from the karyotype we would identify as male. If you look at the 23rd pair, the chromosomes are non-matching, regarded as being XY. Here we have another condition which can be detected by a karyotype. You'll see chromosomes 1 to 22 are fine, 22 matching pairs. But at chromosome site 23, you'll see that there's an extra set of genetic information. We have 2 X chromosomes and a Y chromosome. This individual would be male. The inclusion of the Y chromosome gives rise to male characteristics. However, the extra X chromosome would make the male infertile, and at the point of puberty and following puberty would not develop secondary sexual characteristics and would remain sterile. Here we have the karyotype for a female who has a condition known as Turner's syndrome. We can see at her 23rd pair that she only has a single X chromosome. Her genotype is regarded as what's called XO. She has a missing second chromosome at the 23rd pair. Up until puberty, she would be developing as a female. At the point of puberty, the secondary sexual characteristics would not develop and she would be infertile. Here we have an example of an assessment standard question asking you to demonstrate your knowledge and understanding to level A. Amniocentesis and chorionic villus sampling are examples of antenatal tests that can be carried out. Describe an advantage and a disadvantage of using amniocentesis rather than chorionic villus sampling. Looking at the marking scheme, an advantage is that amniocentesis has a lower risk of miscarriage, the disadvantage, however, being that it is carried out later in pregnancy. I would ask you to evaluate your own learning here against the 5 learning intentions highlighted. If there's anything that you're unsure of, I would suggest you go back to previous slides and revisit the learning.